So 7 years ago, we decided to start using online social media-based technologies to address each and every one of the big challenges that we have in youth mental health. So we have pioneered the use of these technologies, and what we have done is develop advanced and enclosed social media platforms that bring together families and young people in a safe and a meaningful way. Our interventions integrate the voice and support of trained young people and families with lived experience. We also have cutting-edge thinking in our interventions designed to build resilience, and also expert support, all of it into the one package, to develop a one-stop shop. We know that only 13% of young men and 31% of young women access the mental health care they need. Even when young people access mental health treatment, we know that they don't engage in treatment for long enough because the support they receive doesn't address the key needs, such as having self-confidence, being socially connected, or getting and keeping a job. And even in the best case scenario, and this is when young people access mental health treatment and they benefit from it, we can only provide time-limited support. And we know that the majority of young people, up to 70%, are going to experience repeated relapses and mental health episodes, which is going to result on long-term disability. So we think this is completely unacceptable. One of our key goals is to actually promote long-term social recovery, long-term functional recovery, which is something that hasn't been achieved. We know that our interventions are very safe, they're very engaging. We can engage up to 70% of our young people and families for periods of 18 months or longer. This is unprecedented in the field. We believe in furthering what we call the science of developing online interventions for young people. What that means is that we're after excellence, not only in the evaluation of these interventions, we're actually pretty good at that. We also are after excellence in the development and in the engineering of these interventions. So to achieve this goal, we work very closely with young people. The voice of young people is key in every step of the process, from thinking about the interventions to designing all the functionality of these interventions, all the way to the deployment of the interventions as well. And these young people have the opportunity to work with a multidisciplinary team of mathematicians that we've called collaborating in the team, comic developers, creative writers, computer scientists, all of us working together to develop interventions that are really high quality. Just like young people ask from us, our interventions have been designed to enhance and to be integrated within the current network of youth mental health services, not to replace what we already have. So we want to cover the needs of all young people and their families, all the way from help seeking and obtaining immediate support in times of need, to accessing face-to-face services and receiving, if needed, integrated face-to-face plus online support, through to receiving ongoing online support to prevent relapse and maintain the clinical gains that have been achieved through face-to-face interventions, covering the entire cycle and the entire experience of mental health care and need. This is our vision.